of 24-hour GI flus, which is pretty uncomfortable, a few days for a normal person. When you have Crohn's disease and no large intestine, is life-threatening and within hours. I went to bed on a Friday night and I was like, something feels a little off. By Saturday morning at 7 a.m., I knew if I did not get IV saline and some magnesium on board, there was a good chance I was going to die that weekend. The problem was, as I was already so depleted, I was not going to be able to get myself to an emergency room. I would have to call an ambulance, which is an absolutely horrific use of resources, because all I needed was a nurse their first day out of nursing school to come give me IV saline and IV magnesium. So instead, I used a company called IV Doc. This is direct-to-consumer IV hydration on demand, and they do things like over-the-counter IV meds for anti-nausea or anti-inflammatory, as well as all of the vitamins, whether it's a multi, a vitamin C, or that magnesium dose that I needed. They had a nurse in my home in less than an hour, giving me a couple of liters of saline and some IV magnesium, and I did that over 4 days. I avoided a 3 to 4 day hospitalization, an ambulance ride, and an emergency room visit purely by hacking it together, right? But the industry is actually going this way because we're seeing things like Medicare now having ambulances going to patients' homes. And if they're able to take it in place, they do, right? Now, IV Doc is fantastic, of course, for chronic disease patients like myself, or if you're dealing with things like longevity and you want to get that extra hydration or extra B12 on board. But, their largest customer base are actually people with hangovers. All right, so let's spend the last 10